Mental health first aid is a concept which was first originated in Australia and has been in the UK for about 12 years. We have trained people in about 20,000 organisations during that time. And a mental health first aider is somebody who is able to understand and knows the signs and symptoms of mental ill health, somebody who's trained to understand how to have a good conversation and to offer non-judgmental advice, and then to support somebody to get help and information, whether that's from a clinical medical professional, a clinician, or whether it's from some other form of social support, or indeed think about self-care. What can they do to look for themselves? But a mental health first aider is really exactly that. They're not a therapist, they're not a psychologist, they're not a psychiatrist. They're somebody who understands signs and symptoms, knows how to listen well, knows how to signpost and make sure that people get good help, advice and support. At MHFA England, one of the things that we do in every one-to-one, first question is, how are you and what are you doing to look after yourself? Now, that was somebody else's genius question, but actually you glean such a lot from that, because it's not just, how are you, of course, and we've all learnt to say fine, but what are you doing to look after yourself? Gives you a real insight into how people are, and of course you can see how that changes over months. So as managers, whether it's a question like that in one-to-ones or the way that we do team lunches, or that people have 15 minutes together, whatever it is, how do you get to know your teams? How do you get to know when you can see that actually people might need a helping hand, people might need questions? Because it shouldn't always be on the person who's struggling or feeling unwell to ask for help. Those of us around each other, we all need help at certain times, so we need to ask people. Becoming a mental health first aider is a 2-day course, and there are courses available every single day, literally, across the country. Mental Health First Aid England's website, mhfaengland.org, has all the information around those courses. So there is an opportunity. You could literally, with manager support or if self-employed, people can go on to those courses. But of course, what you also need then is an organisation that recognises right at the very top that mental health is important, that there's a mental health policy and framework in place, that if there are mental health first aiders, they're trained and supported and have got opportunities to network, and that they're really clear about their role and responsibility. And that's absolutely vital, because like if you're a trade union official, like if you're a physical first aider, you need to know and understand what the boundaries are of your role. So if there aren't mental health first aiders in your organisation and you want to find out more, go on to MHFA England's website. There's advice for organisations, advice for employees. The office phone number is there. Pick up the phone, somebody in my team would be very, very happy to talk to people all about it.